Hi ma'am, my name is Ben. What brought you into the ER today? I'm 31 weeks pregnant and having really bad contractions. Congrats, baby's almost here. First one? Yeah. Okay, we're gonna get you up to labor and delivery right now. Is there anyone else with you? My husband's parking the car. He should be coming in soon. Yo, Ben, break time. Ready? I gotta take her to L&D first. Why is the floor all wet? Oh no. Is that? Fuck. Did you just curse? No. Oh my god, are we gonna have to deliver a baby? Dude, shut the fuck up. We are not delivering a baby in the ER. Why not? Because I've never done it before. Aw, me neither. It could be our first time. Focus, man. Right. Okay, what do we do? Ooh, I got it. Help! 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 What the? Dude! Help! There you are. I've been looking everywhere for you. Hi, honey. Oh, you dropped your water bottle. I was looking for that. Careful, you two. She dropped water on the floor. Dude, why did you freak out? I didn't freak out. You freaked out. Hello, welcome to the ER. How can I help you? Me and my boyfriend were at work, and he's not feeling well. He doesn't look too good. Can you tell me what happened? We were out late drinking last night and had to get up early for work. He's probably hungover. Have you taken any medications like Advil? No, but he did chug a Vietnamese coffee and 1.5 Red Bulls. Why? To help him wake up for work. Huh. Tips from the ER. Restraints. We here in the ER are happy to help you stay in bed if you can't do it yourself. Whether you're aggressively drunk, methed out, or just plain annoying, we're gonna tie you down. I told you to stop walking up to the nursing station. We will come to you. Restraints are what we use when we've had it with your physical activity. We call our trusty security guards, everyone grabs a limb, and we strap you to the bed. Depending on how naughty you are, we can tie just your wrist or include your ankles. Kinky motherfuckers, aren't you? Try spitting on us and we're gonna take care of that too, by putting a spit bag over your head and hoping you don't throw up. Can't have you drowning in your own vomit. That'd be bad. I've had to tackle patients and I've had patients tackle me. You may get one good swing in, but after that, rest assured, we're gonna swarm you faster than a Best Buy on Black Friday. Tips from the ER. Things not to come to the emergency room for. A COVID test. If you are feeling sick with a sore throat, cough, and or fever, please stay the fuck at home. Because even if you got a positive test result and you indeed have COVID-19, guess what you should do? Stay the fuck at home. And if you're still unsure, ask yourself, in your current state, do you need a $30,000 ventilator machine to help you breathe? If not, you should stay the fuck at home. And if you motherfuckers are still confused, turn on the TV, look it up online, and you will see that the only thing that has ever been recommended to you was for you to, say it with me now, stay the fuck at home. Tips from the ER. Burns. First degree. If you've just burned your hand touching something hot like a baking sheet, curling iron, or yourself because you're one sizzling hot motherfucker, fear not. The first thing you're going to want to do with a burned hand is run it under cool water. Not ice cold water, cool water. We got to slowly cool down your hand, which means you're going to leave it under cool water for longer than 5 minutes, people. Also, stop putting unnecessary shit on your burns. Toothpaste, butter, soap, eggs, raw meat. Where'd you even learn this shit from? Are you trying to make things worse to come see us in the ER? Because you don't have to. First degree burns aren't typically life-threatening. Just depends on where it is and how big. For example, if you burned your entire fucking face or a large portion of your body because you were laying out in the sun too long without sunscreen, then maybe go seek medical help. But definitely always put on sunscreen. Yo, shoes came in today. Nice. Ooh! Wait, these aren't the ones I ordered. I wanted the blue ones. I got the blue ones. Ben, these are for women. Sorry, Austin. They're free hospital shoes. Sometimes the orders get mixed up. That's kind of unfair. Do you want to trade? Really? No. Ha! I'll be in triage. Hello, welcome to the ER. How can I help you?
My nose won't stop bleeding and I keep throwing up.
It's because you're tilting your head back. Tilt your head forward and hold your nose.
Really?
Yes, never tilt your head back when you have a nosebleed.
Okay. Why not?
Because you're gonna start drinking your own blood. It's gonna make you nauseous. That's also why you're throwing up.
Oh, I didn't know that. My mom always told me to tilt my head back.
Well, tell your mom she's wrong and hold your nose tighter. You're gonna get blood on my new shoes. Sonny, there you are. What are you doing? Tilt your head back like your mother told you to.
Oh, okay, Mom.
No, what? Dude, we just talked about this. Ma'am, he has to tilt his head forward. Forward.
Oh, okay.
Excuse me, how are you gonna stop the blood? Head back.
Okay.
No, forward. I said back.
I'm getting a little nauseous.
Forward. Back. Forward. Back, tilt back, tilt back. Why do you want to trade shoes now? You know, I just think that it's so uncool that they messed up your order, and I want to be a good friend. What's that smell? What? I don't smell anything. Hello, emergency room. How can I help you? I need help! My wife is pregnant and her contractions are 2 minutes apart. Is this her first child? No, you idiot! This is her husband! Sir, I'm gonna need you to calm down. Okay, sir, you're just about checked in. We only have one more question. What do you do for work? I work with animals, actually. Oh, I love a man who works with animals. Where do you work? I'm a butcher. Okay, sir, we are gonna have to remove this ingrown toenail. Oh no! Oh no! Oh my god, oh my god, oh my god, please, no, I can't, I'm scared! Don't worry about a thing. I just looked up how to perform this operation on YouTube. What? I mean, everything's gonna be fine. Hello, what brought you into the ER today? I keep seeing a werewolf with really big, sharp teeth. I think it's chasing me. Have you seen a psychiatrist? No, just a werewolf. What the doctor is saying versus what they actually mean. It's chronic. It's been happening for a long time. It's acute. It just happened. It's benign. It's harmless. It's idiopathic. I have no idea why it's happening. Hello, welcome to the ER. How can I help you? I was at McDonald's and I think they put blood in my burger. Why do you think that? Because it looks like blood. They said it's ketchup, but I think it's blood. I see. And what do you want us to do? Can you send it down to your lab for testing? No. Okay, sir, so it looks like that pain you're feeling is an STD. That's impossible. Why is it impossible? Because the last time I did it, we were in a hot tub. So? You can't get an STD in a hot tub. Why not? Duh, because the heat kills the bacteria. Right? No. Hello, welcome to the ER. How can I help you? I need a refill for my birth control. That's not something we normally do in the ER. Have you tried talking to your doctor or going to a pharmacy? I was just at the pharmacy, but they never give me and my boyfriend enough. That is pretty odd. What do you mean you and your boyfriend? Me and my boyfriend take one every day, and there's never enough. Wow. Seriously? Code blue, room 12. Ben! Code blue, room 12! I'm coming, get the crash cart! Got it! Oh, excuse me, can I ask you a question? Not now, kid, code blue. I'm right behind you. But I just have a really quick question. What? Do you know a shortcut to get outside? I'm trying to catch a rare Pokemon. I am in the middle of an emergency. I am too. This is a legendary. Ben, come on. Hello? Hello, what brought you into the ER today? Yo, I need an IV stat for this massive hangover. I'm sorry, sir. We don't provide IVs in the ERs for hangovers. Isn't that the best way to get rid of a hangover? It is, but it's gonna cost you like $1,000. Well, how much for a Gatorade then? I don't know, maybe $2? Fine, I'll take it. Bring me a Gatorade. Sir, the vending machines are outside. Ugh, useless. Good luck. Hey. What? I have a question for you. Shut up, I'm trying to pay attention. But it's about anatomy. This better be good. What's the last thing that happens to a Tickle Me Elmo before it leaves the factory? What does that have to do with anatomy? It gets testicles. Get it? Okay, sir, you're here for a buttock pit.
Hi, yes, that's me.
Let me guess. Broomstick?
Actually, it's a sledgehammer. Oh,
You took the head of the hammer off first, of course.
no. It's in my butt.
I beg your pardon?
Hammer side in.
Sir, why would you...
I lost the bet.
Huh, that's not all you lost.
I'll say, I almost got lost driving here. Oh my god.
How did you manage to drive here?
Very carefully.
That somehow makes it even more confusing. Hey, I'm gonna need a portable x-ray, surgery consult, and a very brave intern. 2 very brave interns.
Can't touch this.
Tips from the ER. Pediatrics. Parents, when coming into the ER with your child, please, for the love of God, stay calm. Stay motherfucking calm. I know the ER is a scary place, but your child is looking to you for reassurance. If you freak out, they will definitely freak the fuck out. Their anxiety is already through the roof just being at the hospital. Fear of what is going to happen to them is usually worse than what is actually happening to them. If you need to step out of the room, we will not think any less of you for it. We actually encourage it. If it'll help us do our job, please, get the fuck out! I mean that in the nicest way possible. Have a good day. Tips from the ER. The Q word. Medical workers in the ER are very superstitious and are most triggered by the Q word. If you come into the ER and it's a little eerie because we have no patients and everyone is calmly sitting, don't you dare comment on it. Specifically, don't say the Q word! Ask anyone in the ER and they'll tell you it's a proven fact that saying the Q word is a green light for anarchy and disorder to descend upon the ER and wreak havoc. It's gonna get busy and it's gonna be your fault. Don't believe me? Get this. Someone said the Q word once and I saw 5 ambulances, 10 patients, and a tsunami show up to the emergency room. Facts. So next time you're in the ER, if you don't want us to hate you, don't say it's quiet. Motherfucker. I really hate people. Why am I doing this to myself? These bitches are lying. Don't they know I have the test results in my hand? Fuck this shit, man. I'm gonna go work at Walmart with the disabled greeters. Just turn up his morphine every hour. He's a DNR. Como se dice, what the fuck in Espanol? They're not gonna make it. Just put the body back down first. Hello. If he wants to walk out that door and into Jesus' arms, I say we let him. Can't fix stupid. Did I say that out loud? I hope the patient moves during this MRI so I can stay here a little longer. It's nice. No screaming. How are we gonna get that thing on a stretcher? I'm sorry, what's your mom's name again? Might as well amp up the morphine. They're not gonna make it out of here anyways. Give me some too. Kidding. Tips from the ER. Cold turkey sandwiches. You've probably heard of them. The emergency room special cold turkey sandwich. More bland than your boyfriend's personality, drier than an 87-year-old's G-spot, and tasty as a brick. Fully equipped with 1 sad piece of lettuce and 1 slice of an unripe tomato. These legendary sandwiches have been feeding generations of patients the bare minimum nutrients necessary for survival. Don't be afraid to ask for as many mustard and mayonnaise packets as you like to drown out the sorrow of these sandwiches as they turn into dust in your mouth. They're available year-round, day and night. Wash them down your gullet with some delicious fruit juices. Apple, orange, cranberry, baby, we got the works. Some places even got the purple stuff. No, we do not carry Sprite in the ER, but if you find a sucker to call down to the kitchen and bring you up one, motherfucker, you won the jackpot! Just don't let them know that I told you how to do it. Joanna Thompson, please follow me. Coming, right here. Randy, get over here. Sorry, that's my son. I couldn't find anyone to watch him. Oh, that's okay. We get kids here all the time. Randy, if you don't stop messing around, this nurse is gonna give you a shot. Whoa, what? Are you gonna behave or do you want a shot? Oh no, I'm not gonna. Whoa. Mommy! See, you have to behave. Okay, we're ready. Help! My husband needs help! What's going on, ma'am? His penis is very swollen. I had an allergic reaction. Ugh! It feels like it's gonna fall off. I'm gonna have you take your pants off. How did this happen? It's all my fault. I read online that you could use coconut oil for vaginal dryness, but he has a nut allergy. Gotcha. Okay. No worries. We'll get you back there and get that taken care of right now. Your husband is doing much better, ma'am. He's almost ready to go home. Oh, thank you. I would avoid any more coconut oil in the bedroom. Yes, of course. I would suggest trying other vaginal moisturizers like KY jelly. Jelly? Yes, KY jelly. If I don't have KY jelly, can I use grape jelly? No, nothing from the kitchen. Oh, okay. Tips from the ER. Sprained ankles. What happened this time? Forgot your house had stairs? On your phone? Missed the curb? Running after your dog and tripped on grass? Couldn't handle your heels on girls' night out? Or some sports ball game you didn't quite warm up for? The reasons are endless, but the treatments are the same. Stay off of it. Your favorite question to ask us, how long will it take my sprained ankle to heal? Well, that depends, motherfucker. How long can you keep off of it? The longer you keep off your ankle, the faster it heals. If you come to the ER and we get you crutches, we're not trying to help you go to that concert or get boozy brunch with your girlfriends. Those crutches are to help you go to work, class, or get from couch to bathroom. What are you doing getting drunk off fruit margaritas at Applebee's on a Tuesday night? Go home. Your crutches hanging off the side of the table are gonna trip a waiter. Stay home and rice. Rest, ice, compress, and elevate that ankle, motherfucker. Hello, sir. How can I help you? I was having a really hard time breathing earlier. It was really freaking me out. Are you still having trouble breathing? No. I actually feel a lot better now that I'm here. Oh, great. What do you think it was? Could have been a number of things. Maybe a panic attack? The important thing is, you're fine now, and you can go home. Do you think maybe I could still get checked out? For what? I mean, I drove all the way over here already, you know? Might as well see a doctor. Are you guys busy? Does anybody know how much longer I'm gonna have to wait? Ayúdame! Ayúdame! Ah! Mommy! To infinity and beyond! Psych consults here. Must be for me. Hey, look, scalpel. Ah! Today is the day, baby. Today is the day. I thought about crashing my car on my drive to work today. Who wants to join me on the 6th floor for a swan dive? If I get one more email about a whiteboard this week, you're gonna have to put me on a hold. We got a screamer coming into room 5! Hey, this woman was screaming for Benadryl. I gave her Valium instead. Ativan is a wonderful thing. Why are you crying? It's not even stage 4. If you find me dead here, make sure to transfer me to another ER. Can't be having my coworkers see me naked. I haven't shaved my pubes in years. Good thing is, if you go down on me, it's just like flossing. I am dentist recommended, baby! You want me to go talk to HR? Again? How's my shift? Nobody died? Tips from the ER. Vicodin. If you've ever checked into the ER for a broken bone, you're likely left with a prescription for Vicodin, a powerful pain-relieving drug made up of acetaminophen, aka Tylenol, and hydrocodone, aka an opioid, which makes Vicodin potentially highly addictive. Just ask Dr. Gregory House. But that's why you need a medical provider to sign off on whether or not you can have some. We get people coming into the ER all the time asking for Vicodin, and sometimes it's hard to tell who's really in pain and who's using it to feed their addiction. Because if you're addicted to opioids like Vicodin and your body doesn't get any, you're gonna start feeling really shitty, motherfucker. Sweating, vomiting, nausea, diarrhea, and of course, the shakes. Your body won't stop shaking. People also get super irritable to the point where they don't mind acting a fool in the ER until they get some. Depending on which ER doctor is working that day, you may get your Vicodin, or you may get escorted out by security. Tips from the ER, vomiting and diarrhea. If I have one more person try to show me a bag of their vomit or a picture of their poop, I am going to lose my goddamn mind. I don't want to see it. Nobody in the hospital wants to see it. I called Jesus. He also said he doesn't want to see it. You want to know the first thing I do when you motherfuckers walk in with a bag of barf? I throw it away, get you a new bag. Why? Because that shit is gross. Just describe it to us. We really only need to know if it's bloody or if it looks like wet coffee grounds, which is also blood. Blood equals bad. Same thing with your poops. Stop trying to show me pictures of whatever disgusting swamp monster came out of your bunghole. We would appreciate a one-word description, bloody or watery. We don't need a high-resolution photo of it through your phone. And here's the thing, if it's what you came into the ER for, then we will, for better or for worse, eventually see it, live and in real time. Tips from the ER, EKGs. If you come to the ER because you think you're having a heart attack, the first thing we're gonna do is get you an EKG. We're gonna take your shirt off, slap 10 stickers all around your heart and chest, hook you up to a machine that will record the electrical activity of your heart, telling us whether or not you are having a heart attack. Don't you worry, motherfuckers. It is painless, you shouldn't feel a thing, and all you have to do is hold completely still, like you're getting an X-ray, but without the radiation. There are many reasons to get an EKG to rule out a heart attack. Major ones include chest pain, shortness of breath, dizziness, fainting, palpitations, and irregular heartbeats. But we get EKGs all the time for many reasons, because it is a simple, quick, low-maintenance procedure that tells us a lot of information about you. Also, men and women can have very different symptoms when it comes to heart attacks. Ladies, something as common as abdominal pains could be an indication of a heart attack. So when in doubt, we will be getting an EKG. Tips from the ER, sprains and swelling. What happened this time? Rolled your ankle on the morning jog? Busted your knee trying a new move in the bedroom? Or did you slip on a banana peel again? Tried to catch yourself with your wrist, but ended up spraining it. Happens all the time. First thing you're gonna wanna do is hold it still. Ankle, knee, wrist, immobilize that motherfucker and get a cold pack on there to reduce the swelling. Always remember to put something between the cold pack and your skin and try not to leave the cold pack on for any more than 15 minutes at a time. Once the swelling goes down, wrap it snug with an ace wrap to keep the swelling away from the injured area and elevate above your heart. I know swelling is supposed to help it heal, but swelling also causes pain, and we gotta get that bitch under control. If you can't bear weight on the injury, there's a chance you may have broke something, in which case you can come on down to the ER for an x-ray, a juice box, and a doctor's note, so you can stay at home and try that bedroom move one more time. Tips from the ER, urine samples. People, listen to me. When we ask you for a urine sample, we are not trying to get you in trouble. Our priority is not to send you to jail. Our priority is to make sure you don't die. We need to know what is in your system in order to take care of you. In particular, if you have abdominal pain, the test will tell us whether or not it is a UTI, which it probably is. Stop lying to us about what drugs you've taken. We could tell. How? Because this is our job. We see this shit every day, 24/7. If it's meth, we have to hydrate you. If it's cocaine, we have to make sure your heart doesn't explode. If it's THC, we will leave you the fuck alone. Maybe get you a snack. If we suspect that you are drunk and you tell us you've had 1 drink, we assume 3. You say 2, we say 6. We multiply by 3 because you motherfuckers are liars. It makes our job so much harder and it puts you at risk. Why do you hate yourself? Learn to work with us so we can get you the fuck out of the ER, which, trust me, is what we all want. Tips from the ER. Deadly gas. One of the most common and deadliest gases to poison your enemies with, motherfuckers. Carbon monoxide. What makes it so dangerous? It's colorless, odorless, causes you no particular pain while it kills you, and it can be found everywhere. Any appliance or machine in your home that burns fuel can produce carbon monoxide, including your car. If you sit in your garage for too long with your car on without proper ventilation, and you start to feel weak, dizzy, nauseous, a little headache maybe, you're being poisoned. It's pretty bad during the winters and power outages when people try to find new ways to stay warm. They turn on everything in the house, close all the doors, trapping in all the warmth and gas, lay down for a nap, and never wake up. It used to be the suicide method of choice, but it's not too easy these days though, so don't even try it, motherfuckers! It'd be nice if we all had carbon monoxide detectors around the house, but if you find someone down from what you think is CO poisoning, open all the windows, doors, and drag their ass outside. Get them to the ER so we can pump them full of oxygen until the only gas left in their system is O2 and flatulence. Tips from the ER. ICU. If you come into the ER and end up being admitted to the ICU, you can rest assured that you are pretty fucked. Whether you came in for a raging infection, heart attack, stroke, or you were walking down the street and got hit by a drunk driver, the ER will do its best to keep your life hanging on by a thread before shipping you off to the ICU. You will be unconscious, and you will may or may not have already been dead. Don't get me wrong, it's not like we want you to leave. We live for this stuff, and hopefully, so will you. But the ER can only do so much before we have to call in the experts who specialize in whatever the hell is going on with you. Heart attack? Cardiac ICU. Brain bleed? Neuro ICU. Need surgery? Surgical ICU. Hell, we even have an ICU for the children and a different one for the babies. That's right, motherfuckers! The ER is only here to get the party started. The intensive care unit will make sure ICU back on the streets. Okay, Mr. Malibu, the doctor will be in to see you shortly, okay? Wait, my man. My girlfriend is in the waiting room. Can she come back to see me? Her name is Abigail. Of course. My wife is also on the way to see me. If you see her, can you tell her I'm not here? Why wouldn't you want her to know you're here? She doesn't know about my girlfriend. I don't want them to meet. I see. And what do you expect me to tell her? Just tell her I'm not here. Or tell her you transferred me or something. You know, make something up. What does your wife look like? Is she about 5'2", blonde, curly hair, wears glasses, talks too much? Got it. I'll let her know you're not here. Solid. Thank you, brother. No problem, brother. Hey, Austin, if Miss Malibu shows up, 5'2", blonde, curly hair, wears glasses, just send her straight back to Mr. Malibu's room, okay? He's expecting her. Got it. Cool. Abigail? Follow me, please. Hi, sir. My name's Austin. What brought you into the ER today? I got a really bad cut on my hand. Pretty sure I'm gonna need stitches. Oh, wow. That definitely looks like it's gonna need stitches. What were you doing? Trying to make dinner for my kids. Huh. You're in a good mood for someone who needs stitches. Hey, these things happen. I'm afraid I'm gonna have to ruin the mood. The wait time's gonna be pretty long. We're super busy. That's okay. Really? Yeah, don't worry about it. I'm an ER nurse. Oh, that makes sense now. I get it. Okay, well, we'll definitely try to get you back as soon as we can. Thanks, bud. Alright, you're all done. Stitches look good, and I have your discharge papers right here. That was really quick. Thanks, Austin. Well, you were still here for 2 hours. Sorry we couldn't get to you sooner. It's all good, man. But hey, can I ask you something? Can I get a pair of those sterile scissors to cut these stitches off myself at home so I don't have to come back? Way ahead of you. I got them right here. You're the man. Have a happy new year. Thanks. You too. Okay, ma'am, I have your medications here. Can you make it a large and I'll take a Diet Coke? What are you doing? I'm ordering food. Ma'am, you should not be eating anything. You're here because your stomach hurts. And you guys are doing nothing to help. I've been here for over an hour. Look, I sincerely apologize for the wait, but I have your pain medication now. We're gonna get you feeling better. I told you when I came in here that I needed a soda. And if you remember, I said that we highly recommend, if you are actually in pain, that you do not eat or drink anything. It's gonna make the stomach pain worse. What do you mean if I'm actually in pain? What? Do you think I'm lying about my pain, asshole? No, of course not. My family runs this fucking hospital, so you better watch who you're talking to, asshole. Yes, with cheese, please. Patient is refusing all medications and continues to have complaints of abdominal pain as she orders a large number 1 with cheese from McDonald's. MD aware. We'll continue to monitor. Okay, ma'am, and does your son have any allergies? Yes, here's a list of all his allergies. Perfect. Oh, and I know it says that he's allergic to eggs, but you could just not put that in the chart. But is he allergic to eggs? Yes, he is, but it doesn't need to go in his chart. Ma'am, if he's allergic to eggs, I absolutely have to put it in his chart. It's for his own safety. No, this is exactly what happened last time. They listed it in the chart and they wouldn't let him order any food with eggs in it. Ma'am, do you know what an allergy is? Excuse me? I mean, what happens to your son when he eats eggs? Are you trying to tell me how to raise my son? No, I just want to make sure you know what an allergy is. You son of a... Attempted to educate patient's mother on the word allergy. When asked to clarify her understanding of the word allergy, patient's mother became very agitated and advised this RN to, quote, get fucked, end quote. Patient resting quietly. We'll continue to monitor for changes and eggs.
Honey, put that down.
I came as soon as I heard.
Louis! Thank you so much for visiting.
It's so nice of you to bring flowers.
And don't worry, I will take care of everything at the office so you can recuperate. Sir, what are you looking at?
I'm trying to find out where this light's coming from.
It's over your bed, dear. See, you pull the string to turn it off.
Last time I pulled your string, you bled for a week.
You pulled your wife's tampon string out?
Louis, that is inappropriate to say in front of your boss.
You're right, I'm sorry. I didn't mean to. I have to ask. Why did you feel the need to pull your wife's tampon string out?
Well, he didn't need to.
I thought it was a loose thread from her dress.
Hanging from between her legs?
Louis!
You cannot speak to my wife that way, Louis.
What? You started it?
What I do with my wife's menstrual blood is my business.
What do you do with her menstrual blood?
Louis!
You're fired.
What? You're the one that said it! You know what? Fine, whatever. Here, take your flowers and shove it up your...
That's exactly what I did after I pulled your string.
You shoved what up where?
What type of ring did you say this was?
A key ring to help with stimulation.
Okay, well, for future reference, I would stick to using rings that were designed specifically to go in your manhood. That's what I told him, but he's too embarrassed to go to a proper toy shop.
For the love of God, honey, not now.
How long has it been stuck like this? Well, it would have been the last time we did it, so about 3 days ago?
Yep, 3 days ago. Definitely 3 days ago.
Are you sure? Looks more like a recent injury, like 1 day max.
Nope, it was definitely 3 days ago.
That wouldn't make sense. If it was 3 days, you'd be in much worse condition. Are you saying my husband was with another woman yesterday?
Dude, what are you doing? Just tell her it's been 3 days.
Yeah, it could have been 3 days. I could check again. Nope, definitely no more than a day.
Dude!
You son of a bitch! Who was she? Probably apply some lubricant.
Tell me right now.
Maybe get you some pain medication.
Fine, you really want to know? It was Shirley, okay? You happy now?
Shirley is my best friend, you a-hole.
Definitely gonna have to call surgery.
I knew you were looking at her ass during my birthday. I'm filing for a divorce right now.
Thanks a lot, man. You cost me my marriage.
My apologies. I'll be more courteous next time I have to give a accurate diagnosis. Okay, sir, my name is Ben. Can you tell me what brought you into the ER today? My stomach really hurts. I'm so sorry to hear that. We're gonna get you back as soon as we can, okay? Can I get some 7-Up to help my stomach ache? Nothing to eat or drink for now, okay? Let's get the pain under control first. Please, can I just have some water? My stomach really hurts. You really shouldn't be eating or drinking anything right now. We'll get you some pain meds as soon as we get you back, okay? Sonny, where are you? What the hell is that? Mom! I'm in here! Sonny, my poor baby. Hi, sir. I'm Mom. Hi. Did he tell you he has a tummy ache? He might have mentioned it. Please help me! Well, can you get him some 7-Up or something to help his stomach? He's hurting. No 7-Up. Why not? What kind of hospital is this? Mom, they're torturing me! First of all, we don't even have 7-Up in the ER. Second of all, you're 42, man! Get a grip! Ben, why did you yell at the patient and his mother? Because everyone is dumb. Hey, Austin, can you cover me in the waiting room? I'm gonna run to the bathroom. Yeah, sure. Thanks, dude. There is a man masturbating in front of my daughter. Oh my God, where? That man right there. Excuse me, sir. What? You cannot do that here. I'm watching TV. There are children here. Okay, all right, I'm sorry. I'm sorry. He's doing it again! Sir! Alright, fine. Okay, I'm leaving. Alright, fine. Hey, I'm back. You won't believe what just happened. Some guy was masturbating in the waiting room. Ew. Did you kick him out? Of course. What took you so long? I was masturbating in the bathroom. What? I'm just messing with you. Thanks for covering me.
You want to work at this nursing home? Let me give you some advice. Stay awake at all times. Drink coffee, do jumping jacks, slap yourself in the face if you have to. Why aren't you writing any of this down?
Hey, everybody!
Hey, I think Mr. Simmons is having an emergency. No, he's not.
I got something to say.
Are you sure? Listen to him. I should go help. Trust me, you're gonna want to wait a second.
I'm coming in my pants.
Did he just say? Yes. Yes, he did. But how is he doing that? He's not. He's peeing. How do you know? Look, after a few months, you're gonna get to know the regulars. Screamers who want attention, old ladies just coming by to hang out, and guys who piss their pants and think they're coming. That's good to know. Thanks. I should go help him clean up, right? Help me get the hang of things? Nah, I'll take this one. You got your whole career to figure this stuff out. Oh, thanks, that's so nice. Oh no, is he reaching into his pants? What's on his hands? Oh my God. I guess he wasn't peeing.
Hey, you!
Me?
Yeah, you! I made a mess here. Help me get cleaned up.
Oh, I can't right now, but our new nurse will be more than happy to help you out. What? You just said, hey, do you want to be a nurse or not, damn it? You gotta learn sometime. Get in there. Fine. Mr. Simmons, I'm coming.
Me too.
Hi, ma'am. What seems to be the problem? I think I gave my baby shaken baby syndrome. What baby? Where's the baby? The one inside of me. I'm 8 weeks pregnant. Oh. How exactly are you hurting the baby again? I have a vibrator stuck up my ass and it's shaking it. Is that what that sound is? Oh, my poor baby. No, ma'am, you have nothing to worry about with your baby. How could you say that? Because you can't give a fetus shaken baby syndrome. It doesn't even have a fully developed brain yet. Because I've scrambled it with my insatiable desire to pleasure myself. No, ma'am, that's not what I mean. And now it'll never have a brain because of that one incredible night I tested the limits to see how far up it could go. Ma'am, listen to me. The vibrator won't hurt the baby no matter how far up it is. Are you sure? I am positive. Now, please try to calm down. Oh, that's a relief. Thank you. Betty, will you come help me with something in here? Present! Is that the Magic Vibration Masher 4.0 in purple? Oh my God, it is! It's so good, isn't it? Betty, we need to remove the vibrator from this woman's rectum. Actually, doctor, if it's not hurting the baby, you could just go ahead and leave it in there. Oh. I should have been a radiologist. Happy to report your daughter is very healthy. No immediate signs of any problems. Are you sure? Did you even check for diabetes? Well, no. For that, we would have to do a series of different testing, but as of right now, I don't see any reason to. Let's do it, whatever it costs. We do not want to risk it. Can I ask why you think your daughter has diabetes? Because looking at her numbers, she's perfectly healthy. She's been exposed! Is there a family history of diabetes? No, our family is perfectly healthy. Has she had high blood sugar in the past? No. Does she have any symptoms of diabetes that I'm not aware of? Not yet, which is why we want to test it before it's too late. Okay, what did you mean by she was exposed? Last week, I let her go on a play date at her friend's house, and today I learned that that friend has type 2 diabetes. We're afraid she may have caught it. Oh, no, ma'am, type 2 diabetes is not contagious. What about type 1? That's the one you can catch, right? Nope, can't catch that one either. Or should I try to have her catch it before it becomes too dangerous, like chickenpox? No, ma'am, you don't seem to be understanding. I think that's a good idea. Honey, make sure to invite all the bigger kids to your birthday party. Anyone who walks the mile in PE. No, ma'am, you can't catch diabetes. You can't give diabetes. Your daughter is perfectly healthy. You have nothing to worry about. Okay, but what about asthma? Can you test her for asthma? Because there was a girl on her soccer team with an inhaler. None of those are contagious! Oh, are you sure? Hi, Merlin. Just wanted to warn you, your patients in room 2 are very high energy. High energy or high energy? They're high as fuck. Ugh. Let's get this over with. I can go faster, babe. You want me to go faster? Whee! Hello? Oh, what's up, man? Hi. Yeah, I'm here to examine someone with a burned hand. Oh, that's me. I burned my hand on the stove. Babe, you can't lie to the doctors. That's illegal. Okay, it wasn't from cooking. It was from my crack pipe. We smoke crack. Ah! Not a doctor, not illegal to lie to me, but good to know. Okay, is the burn infected? Are you in any pain, ma'am?
Oh, nothing that bad. It's been really hard to work lately.
Ask her what she does. Do it. Ask her. Fine. What do you do for work, ma'am?
I'm a pole dancer.
She's a pole dancer!
Yeah!
Great. Can I please see the burn?
I love this woman!
Shake it. There, shake it.
Dance
Shake
with
it.
me, babe.
Shake
Dance.
it.
Guys, look, if I get you some ointment, will you please just leave?
Ointment? Come on, man. What about the meds?
I think we both know you're good on meds.
Oh,
He got us.
He caught us.
babe.
He caught us.
He caught
us.
us. He caught us, babe. He
He
caught
caught
us.
us.
He caught
He
us.
caught us. No! He caught us.
He caught us.
All right, what is this? 13-year-old male got drunk with some of his buddies and thought it'd be a good idea to jump out a second-story window. Cracked the back of his head wide open. This is nothing, little boy. I broke my arm when I was 10. This shit is nothing. What's his name? Joshua. He's still pretty drunk. Joshua, what are you doing drinking alcohol at 13, man? It's what we do where I'm from. We're gonna have to staple the back of your head back together. Whatever. I'm not scared. The fuck, little boy? Where are his parents? His mom was at work. She's on her way. 10-4.
Hey, Ben. Are you okay?
Yeah, I got this kid in room 3 who keeps acting like a tough guy, and I'd really love to check him.
Excuse me, I'm looking for my son, Joshua.
I'm taking care of him. Please follow me. Joshua, you got a visitor.
Who? Joshua, are you okay?
Mama! What the?
I'm sorry. Oh, I know, honey. You're okay.
I didn't mean to let you down. Don't be mad. Mommy! Sir, I already told you I have no idea how much longer it's gonna be, but we are doing our best to get to you. I promise you. Look, 45 minutes is really not that long of a wait.
Hey, Rich. What's up?
Oh, you know, same old. Mr. Gabbert came in with toe pain, wants to know how much longer he has to wait.
Toe pain? I just saw him walk away. He wasn't even limping.
I know, right? And I told him the same thing I told everyone else. It's gonna be a bit of a wait.
Actually, maybe not. We don't have that many urgent needs at the moment.
Really? What are all these people doing here?
Nothing urgent.
You're actually telling me Mr. Gabbert with toe pain is next?
I mean, you could take the guy with the itchy asshole.
Ew, what? No!
Okay, what about the lady that rolled her ankle?
That was yesterday.
Nope, look, she's here again.
Oh yeah, there she is. Pass.
Okay, what about this guy? He got a ring stuck on his huge
Hell no!
finger.
Is there really no one here who needs my help more than toe pain?
Well, Rich, I mean, you could look for yourself.
Wait, what about her? She looks upset. What is she here for?
She just walked in.
Great, maybe she's actually here for something important.
Hi, I need to see a doctor.
Okay, well, the triage nurse here will get you checked in. What seems to be the problem?
I need a pregnancy test. Quickly, please.
Mr. Gabbert, if you could follow me, please.
I don't get it.
I don't understand. Ben, why isn't she texting me back? Dude, shut up. We're at education training.
Welcome, everyone. My name is Sarah, and today we're going to be introducing to you a new type of IV.
We had a good time. She kissed me. This makes no sense. Maybe the kiss was bad. The kiss was not bad. I'm a great kisser.
With this new IV, you'll be able to grip the needle better, making it easier to insert into the vein.
And we're both in healthcare. Like, we understand each other. Clearly not enough. You think she's seeing other people? Probably, yeah. Really? Dude, come on. You went on one date.
Ahem. And just like the old IV, you press the gray button to retract the needle.
No, you know what it is? She's intimidated.
Intimidated by what?
By her love for me. Love? Dude, you barely know her. Which makes it all the more special, right? Like I knew I loved her after just one date. That's rare. I need you to calm down. And I need you to raise your energy level to meet mine.
Gentlemen, is there something you'd like to share with the class?
Yeah, actually, there is.
Ben wants to know why you aren't responding to my messages. Really, Rich? You want to do this right here? Well, Ben is pretty upset about it.
I didn't say anything.
Can I speak to you outside, please?
Yeah.
No, I don't know him.
Ben, come on.
Tips from the ER. Enemas. Enemas are not common for young people. Let's just get that very clear, okay? If you are in your 20s, in your 30s, it's very uncommon that you're gonna be coming to an ER and we're gonna be giving you an enema. In the ER, I assist with a lot of enemas for older people. People who don't really have control of their bowels and their muscles anymore, or something's going on that, is now fucking with their stomach. Just to be clear, if you are a young, fairly healthy individual, we're not gonna stick anything up your ass. Unless you ask us to. Now, just like the medications, you can do an enema at home. Ta-da! You can buy these over the counter. You don't have to come to the ER to give yourself an enema. You could do it by yourself. This is what it looks like. There's a solution in here, there's a tube in here. You can guess which goes where. You stick it in, you squeeze the bottle, keep that liquid in you for as long as possible, and then when you're finally ready, get your ass to the toilet and let it rip. This is here to protect the tube so it stays sterile. We're gonna pop that off. Let's see how quickly this squirts up. Oh, that's some good pressure. It tastes like a flat 7-Up.
Stop it. Get some help.
These are $1 a piece. I got 4 for $4, and that's not even on sale. That's just how much they cost. Come to the ER, won't be $4. But remember, always read the directions on how to use it.
All right, Miss Cosmo, just have a seat right here and someone will be with you shortly. Excuse me, is this a COVID-free bed? A what? I need a COVID-free bed. We don't really have, special beds. I don't need a special bed. I just want to be in a normal bed instead of a COVID bed. Don't you people keep those separately? Ma'am, this is an ER. We don't have beds that are only for COVID patients. Well, don't you have a few beds that are COVID-free? I want one of those. Ma'am, your health and safety is our biggest concern. Then get me a COVID-free bed. We don't really have the space or resources to have special COVID-free beds. So you just send those COVID people wherever? We treat them just the same as everyone else, yes. So there was one in this bed. Most likely, yes. Don't you take that tone with me. This is a hospital, for crying out loud. Don't you know anything about keeping things sanitary? Now I want a COVID-free bed, and I don't care. I'll wait. You know what? You're right. The moment I saw you walk in, I thought, hey, let's unbox a brand new $50,000 bed just for her. You know what? Here. Hey, Joey. Yeah, bring up one of those new beds for my girl Karen here. She's just that special. Why, Ben? Just why?
Sharon, you really shouldn't be working so hard after giving birth. I have people who rely on me. Well, I'm gonna take your little one to the nursery. We'll be back in a few hours so you can breastfeed. They said the baby is perfectly healthy, right? Baby's perfectly healthy. See? Told you. Okay, Sharon, ready to feed your... Hey, have you seen my patient who just gave birth? No, is everything okay? I can't find her anywhere. It's time to feed her baby. How long has she been missing?
3 hours?
3 hours? Why didn't you say something earlier? I thought she was just walking around working. I was waiting for her to come back. For 3 hours? I know! Help me! Have you told security yet? They can't find her either. Do you think something happened to her? I don't know. Does she have an IV? Oh my god. She does! Any history of drug use? I don't know! Am I gonna lose my license? Okay, just calm down. Try her emergency contact number. Maybe she's with them. Okay. Hello? Hi, I'm looking for Sharon. Speaking. Oh my god, Sharon, where have you been? We've been looking all over the hospital for you. Oh, I had my friend come pick me up. I had to go home to see my baby. You have other kids? Oh no, Mr. Snuggleton, my cat. It's almost time for him to eat. Yes, it is. Okay, but what about your actual baby? It's her feeding time too. Oh, right. Can you just give her a little Jell-O? No red though. I heard the red dyes are bad for kids. I would give her formula. Perfect. I'll be back soon. No, Sharon, you need to get back here right now. You still have an IV in your arm. Oh, this thing? I'll just pull it out. No, Sharon, do not pull out your IV. Done. Oh my, that's a lot of blood. Are you freaking kidding me?
Help!
Girl, your girl is here and she's locked in. Tell me, what's the tea?
My private parts are bleeding and it really hurts.
Babe, I think it's just that time of the month.
Is this your BF? Tell me, Mr. Wikipedia, do you explain menstruation to your mother too, or are we just lucky?
No, but her period happens every month, so it must be. What are you doing?
Oh, I'm texting my Florence Nightingale group chat that a man is trying to mansplain periods to us. Be so for real right now. As I was saying, tea?
Well, we were having sex earlier.
Really good sex.
I doubt that.
He wanted to try something new.
Because you wanted me to try something new.
Sir, this queen is trying to have a conversation with another queen, so you can take you and your interjections to the waiting room, or...
So we were trying something new and he wanted to put a Jolly Rancher down there.
Girl, no!
Yeah, and then he bit down really hard.
Girl, no!
And now it won't stop bleeding and it really hurts. I think it might be a problem.
Oh, there most definitely might be a problem. Okay, I'm gonna go snatch the surgeon because we are gonna have to stitch that snatch up ASAP. I'll be right back, bestie. Patient is a 23-year-old female who sustained an unjolly laceration on labia during intercourse. On-call surgeon sutured laceration. Patient in stable condition.
On the bus every goddamn day for you.
Patient's boyfriend did not pass the vibe check. Patient's relationship in unstable condition. And that's the tea. Period. Happy Thanksgiving, Rich.
Austin, I have a patient for you in room 2. Foreign body object in rectum.
Oh, do we know what the object is?
X-rays just came back. Can you guess what it is?
That's a jar.
Not just any jar, a turkey gravy jar. That ass gobbled.
Why would you stick a gravy jar up your rectum?
Duh, to heat it up before dinner.
That's gross.
I call it Mother Nature's oven. Come on, I'll introduce you. Sir, this is Austin. He's gonna be taking care of you.
Nice to meet you, sir.
Do you know when I'll be able to leave? Oh, you're being admitted, sir.
The surgeons are coming down to talk to you now.
What does that mean? Is it gonna take long? Because I cannot have my wife finding out about this.
Ross, what are you doing here?
Oh no.
You better not be faking an injury to get out of cooking again.
Honey, hi. How did you find me here?
I tracked your location. You said you were out looking for stuffing. What is so funny about that?
Nothing, ma'am. Please continue.
I worked all day in that kitchen, Ross, and I know you think I'm anal. But Thanksgiving is very important to my family. It brings us together. It fills all the holes. Wow. So whatever reason you're in here, it better be lethal because I am not cooking the rest of that dinner by myself.
Honey, if you could believe me, I actually injured myself prepping part of the dinner.
Oh, really? What part of the dinner were you prepping?
The gravy.
You hurt yourself prepping the gravy that I already made and jarred 3 days ago?
Yes?
That's it. I'm leaving. You two can keep him here for as long as you want.
But honey, I'm telling the truth.
I'm sure you are. Why don't you take that precious little gravy jar and shove it up your ass?
It's okay, she's gone. You can laugh. What? I'm fine. Austin?
She said shove it up your ass! I'm sorry. That's not professional.
Well, I might have been touching myself last night by maybe putting a Tic Tac in and out of my pee hole, and it may have gone too far, and now it might be stuck.
I see. But you've been able to pee since then?
Well, yeah, but it burns, and orange pieces of Tic Tac are coming out. This is like really bad, isn't it?
Well, it's not really good, but luckily I have a colleague who used to work in urology. Let me call them and see what they can do. Hey girl, hey!
Betty, I was just calling you.
Why? Because I'm in my main character era?
No, because...
Because you need to make a charge and my face card never declines?
No, because...
Because this man put a Tic Tac in his urethra, got it stuck, and you're hoping I know what to do because I used to work in urology?
Yes.
How did you know that? I heard everything from outside the door. Hello. Okay, King. First things first, we have to determine if that Tic Tac, which I am legally rebranding to Tic Tac, is going to dissolve.
Betty!
What?
That's so rude! That's okay. How do we know if it's going to dissolve?
Betty! What? I have to experiment to see if it's going to dissolve. It's like, how many licks does it take to get to the center of a Tootsie Pop? The answer is 1,000.
Okay, fine. What happens if it doesn't dissolve?
Then we need to determine if it's caustic to the urethra. That means we need to determine if it's dangerous to the inner lining of your pee hole, good sir.
How do we do that?
Just dropped it in my urology group chat, and good news, tacks are not toxic.
Oh, that's great. Is there bad news?
Well, the bad news is because they're not Skittles, you won't taste the rainbow. Woo! Woo! I am on fire today.
Betty, focus, please. Okay, real talk. We have to see if the doctor can remove it. If not, he's gonna prescribe you Peridium. What's Peridium?
Pain reliever. Totes perf for your situation. But a side effect of Peridium is that you will pee orange.
But I'm already peeing orange.
Correct! But this time it won't be because of the tax. You're in your orange pee aesthetic era, babe, and I am so proud of you.
Thank you so much, miss.
Yes. Thank you, Betty. You're welcome! Okay, besties, this main character is clocking out of the storyline, but don't you worry, I'll be back for my sequel. Ta-ta now. Who was that?
Ahem. Richard. Hi, Ronnie. How's pharmacy life? Your patient's getting admitted. They need their medications updated. You mean our patient is getting admitted and needs their medications updated, right? Either one of us could do it, you know. We'll see. Hey, can one of you verify bed 2's meds? He will. Okay, maybe you two can work on it together? She has a whole purse full of loose pills. I can't even tell what's what. She didn't bring a list with her? Nope. Good luck. Well, let me know if you have any questions. Whoa. This seems like a pretty complicated list of medications. Don't you think a pharmacist is needed? I mean, drugs are your specialty. Oh no, the key to an accurate list of medications is communication. And you, Nurse Richard, are the expert at good patient communication. Goodbye. But, if you want to get better at communicating with patients, you should start right here, with this one. I don't have time for chit-chat, Rich. I have to go mix drips for a very sick patient in 12. Well, I'm getting a new patient, so it looks like I'm busy too. Oh, hey, Rich, don't worry about that patient. They're going to a different hospital. What? Ho ho ho! Oh, and Ronnie, don't worry about the drips in bed 12. The patient's dead. What? Family pulled the plug. Don't forget to verify the meds in bed 2, guys. So, it looks like we both have time now. It would appear so. You know, Ronnie, maybe if we worked on this together, we could knock it out quicker. No, yeah, fuck that. I have a better idea. Do tell. Wait, what? Why me? It's your patient, and we're very busy, so good luck. What are you doing? You guys didn't hear? We're going on strike. Not gonna happen. What do you mean? I've been here long enough to know the hospital will give in at the last minute. They always do. But what if they don't? They're asking us to take more patients. Ha! Is something funny, traveler? No, nothing. It's just, man, you California nurses don't realize how good you have it here. And where are you from? New York. You California nurses. Oh no, I'm not getting 5 patients. Are you freaking kidding me? In New York, I was at an 800-bed hospital. It would be me, an LPN with 1 leg, 2 PCTs who only spoke Albanian, and a seeing eye dog with cataracts. We take care of that whole place. Why do I feel like that's not safe? What are you talking safe? Each patient would be bathed, medicated, and receive an hour-long shiatsu massage and aromatherapy treatment from Bath & Body Works by the time day shift rolled around. That math doesn't add up. Not to mention, we also had to cook all the meals, wax the floors, and make bedpans out of furniture that had been thrown into the East River. Ooh, gross. Did you at least get breaks? If you called smoking half a cigarette while hunting for loose Skittles on the floor of Pediatrics a break, then yeah, we got breaks. Wow. Maybe we shouldn't strike. Things are way better here than that. I couldn't survive on just floor Skittles. What, are you kidding me? Why do you think I'm here? It's because you nurses actually use your voices. And we're not even taking care of 800 patients. Alright, I may have exaggerated that a little bit. It was more like 722. But still, if y'all don't keep fighting for what's right for you here and your patients, How's the rest of the country gonna change? Am I right or am I right? Yeah, we're agents of change. We could make a difference. Don't get me wrong. You're all whiny little fucks. But for the most part, you're doing the right thing. Oh look, the hospital caved. Strike is off. But it counts that we were ready. Does it? What does this tell you?
Mr. President, thank you so much for taking the time to meet me.
Oh, it is an honor to meet the president of the Nurses Union. So, how can I help?
The staffing shortage is dire, Mr. President. Most units are reporting unsafe staffing ratios, and burnout is rampant. We want to continue to help our patients, but under these conditions, we need help ourselves.
You are so brave.
Thank you.
You're so brave.
Thank you. What we're asking for is a 25% increase in wages over the next 4 years, as well as a promise for additional hires and an internal registry for on-call union nurses. Is everything all right, Mr. President?
You are so brave?
Again, thank you, but we really need these changes in order to retain staff.
Staff. Okay, I hear you. And I hear your concerns. I think we can work something out.
Well, that's great. Thank you, Mr. President.
My first counteroffer, which I think is very fair, pizza on Tuesdays.
No, sir.
But only one per unit.
Sir!
And none for the night staff because I never have to see them.
Sir! These are your employees, the backbone of your company. Have you no sympathy?
Look, I get it, and we're all operating at a loss. I never told this to anybody, but last year, my salary got decreased by 10%. Decreased? I mean, can you imagine only making $12.7 million a year when you made $13.7 the year before?
Mr. President?
Oh, thank you, Giles. I was just informing my publicist that wearing a t-shirt makes me more relatable. Now, where was I? Oh yes, pizza on Tuesdays!
Mr. President, me and 30,000 of your employees are willing to walk out and strike if you are unwilling to meet our demands.
Secretary, get me Brian on the line.
Yes, Mr. President. Brian on line 1, Mr. President.
Thank you. Oh. I would like to apologize for my behavior earlier. You guys aren't just the front line of this organization. You are this organization. We would be nothing without you. That was my friend Brian Nickel, the CEO of Starbucks. As a token of my appreciation, I would like to offer each and every one of you a free medium coffee.
Well, that's very kind of you, Mr. President.
After you spend $20 or more on eligible goods.
Mr. President, come on!
Okay, I'm here. Where am I going? Morning, Ben. I'll let you guys decide. Room 2 is an old meth-addicted lady who's just brought in by ambulance for what's likely sepsis, and room 12 is a pediatric patient, but I'll take the meth lady in room 2. You don't have to run just because I said pediatrics! This is awesome! I love kids! No, but wait! Ah, come on! I wrote down information for you guys! Alright, what's going on? 72-year-old female found down in her apartment, A&O times 2, fever of 102, and a heart rate that's been fluctuating around the 150s. We also put her on 5 liters of oxygen. She definitely has an infection. Who called it in? Her neighbors. They also told us an interesting story about her. What, that she's a meth user? Apparently she's also a sex worker. Like currently or in the past? Currently. It's the only way she could pay for the meth. Who would... She's 72! Some people have their kinks, Ben. Ugh, I'm not even gonna think about it. Anything else? She's also got a colostomy that's looking a little funky. Oh yeah, it's really red. That's not good. Alright, we'll check it all out. Thanks, man. Hey, Doc, did you see the lab results for meth lady? Yeah, blood work's all negative. I know. What do you want to do? It's so weird. She definitely has an infection somewhere. Did you see her colostomy? I did. Definitely doesn't look normal. Do you want to culture it? May as well. I don't know what else to do. I'll do it. Thanks, Ben. What the? Oh my god. Ben, did you see the results? Yeah. Ma'am? Ma'am, wake up. Ma'am, we found syphilis and MRSA in your colostomy. Have you been using your stoma for sex? Ma'am, that is extremely dangerous. You should not be doing that. A hole is a hole. Whoa, Ben, you okay? I should have taken that pediatric patient. That pediatric patient was 17 years old, 200 pounds, and combative. Still a pediatric patient. My meth lady was letting people use her stoma for sex. Ew. Oh yeah, that's called a Philadelphia sidecar. Why do you know that? What? You guys never just get lost on the internet? No? Oh. Okay, well you should Google it. Not here though. At home. That's gross. It's not gross, it's for learning. I'm gonna go throw up. Me too. I'm just trying to give you guys information. Ugh. I am so unappreciated here.